Addisonian crisis, adrenal crisis. Nursing summary. Definition. Addisonian crisis is a life-threatening medical emergency caused by an acute deficiency of cortisol and often aldosterone in a patient with Addison's disease. It usually occurs when the body is under significant stress and cannot produce enough cortisol to meet increased demands. Causes or triggers. Common precipitating factors include infection or sepsis, most common cause, surgery or major trauma, missed corticosteroid dosage, vomiting or diarrhea without absorption, severe illness, example influenza, gastroenteritis, Waterhouse Friderichsen syndrome, acute adrenal hemorrhage, clinical pearl. Any ill or injured patient with Addison's disease should be evaluated immediately for adrenal crisis. Clinical manifestation cardiovascular, profound hypotension does not improve sulfonides alone, shock, tachycardia. Neurological, severe weakness, fatigue, confusion, lethargy, altered mental status. Gastrointestinal, nausea, vomiting, severe abdominal pain, diarrhea. Other, fever, dehydration. Characteristics, laboratory findings. Remember the Addisonian electrolyte triad: hyponatremia, hyperkalemia, hypoglycemia. Additional findings: elevated BUN, creatinine, dehydration, metabolic acidosis. Differential diagnosis: septic shock versus Addisonian crisis. Both conditions may present with hypotension, fever, altered mental status. Features suggesting Addisonian crisis: history of Addison's disease, long-term corticosteroid therapy, hypotension unresponsive to IV fluids, hyponatremia, hyperkalemia, hypoglycemia. NCLEX tip: if IV fluids are not improving, hypotension in a patient with adrenal insufficiency, think cortisol deficiency. Emergency management: IV hydrocortisone. Priority: hydrocortisone 100 milligram IV bolus immediately. Administer without waiting for laboratory confirmation if adrenal crisis is suspected. Rational: cortisol replacement is essential to restore vascular responsiveness. IV fluid 0.9% normal saline. Add dextrose if hypoglycemia is present. Purpose: correct hypotension, restore circulating volume, treat hyponatremia, correct hypoglycemia. Monitor electrolytes, monitor sodium, potassium, blood glucose. Potassium typically decreases as corticosteroid therapy becomes effective. Treat the underlying causes, example antibiotics for infection. Resume steroid therapy, treat vomiting or diarrhea, manage trauma or surgery related distress. Continuous monitoring, closely monitor blood pressure, heart rate, respiratory status, neurological status, urine output. Prevention, medical alert identification. Patients should wear medical alert bracelet or necklace indicating adrenal insufficiency. Emergency hydrocortisone kit. Patients should have injectable hydrocortisone available. Family members trained to administer it. Sick day rules. During illness, double or triple the prescribed steroid dose as directed by their healthcare provider. Seek emergency care if unable to keep medications down due to vomiting. Before surgery, patients should inform healthcare providers about Addison's disease. Receive stress dose corticosteroids before surgery or major procedure. Nursing priorities: assess for signs of shock, administer IV hydrocortisone immediately, start IV normal saline with dextrose if indicated, monitor electrolyte and glucose levels, identify and treat the precipitating cause, monitor vital signs continuously, educate the patients regarding lifelong steroid therapy and emergency precautions. Ankylosing spondylitis points, blood pressure, severe hypotension, refractory to fluids, sodium, hyponatremia, potassium, hyperkalemia, blood glucose, hypoglycemia, priority medication, IV hydrocortisone, priority fluid 0.9% normal saline, plus minus dextrose. Most common triggers: infection plus infection or sepsis. Emergency, yes, medical emergency. Easy mnemonic টা হচ্ছে Addison's add steroids. AA add hydrocortisone immediately. D dextrospars normal saline. Don't wait for laboratory confirmation. Identify the trigger shock from cortisol deficiency. Observe electrolytes and vital signs. Never rely on IV fluids alone.